Hello everyone, this is Ed, and in today's video we're going to talk about the health of your teeth and gums. Understanding gum disease, the silent threat to your health. Gum disease, medically known as periodontal disease, is a pervasive oral health issue that affects a significant portion of the adult population. According to the Centers for Disease Control and Prevention, CDC, approximately 42% of adults aged 30 years and older in the United States have some form of periodontal disease, with nearly 8% suffering from severe periodontitis. This condition is characterized by the inflammation and infection of the gums and the bone structure supporting the teeth. It typically begins as gingivitis, marked by red, swollen gums that may bleed during brushing or flossing. If left untreated, it can progress to periodontitis, leading to gum recession, bone loss, and ultimately, tooth loss. The World Health Organization, WHO, estimates that severe periodontal diseases affect more than 1 billion people worldwide. The hidden dangers of gum disease. Beyond the immediate oral health implications, gum disease poses several hidden dangers that can impact overall well-being. Systemic health connections. Research has linked periodontal disease to an increased risk of systemic conditions such as heart disease, diabetes, and respiratory infections. The inflammation associated with gum disease can contribute to the development and progression of these conditions. Cognitive decline. Emerging studies suggest a correlation between periodontal disease and cognitive impairments, including an elevated risk of dementia and Alzheimer's disease. The bacteria from infected gums may enter the bloodstream, potentially affecting brain health. Complications in pregnancy. Pregnant women with gum disease may face a higher risk of adverse pregnancy outcomes, such as preterm birth and low birth weight. The inflammation and infection can interfere with fetal development. Recognizing the signs of gum disease. Early detection is crucial in managing and reversing gum disease. Key signs to watch for include bleeding gums. Gums that bleed during brushing or flossing are often an early indicator of gingivitis. Persistent bad breath. Also known as halitosis, this can result from the accumulation of bacteria in the mouth. Swollen or tender gums. Inflammation and sensitivity in the gum tissue can signal infection. Receding gums, gums that pull away from the teeth, can expose tooth roots, leading to sensitivity and increased risk of decay. Loose or shifting teeth. As the supporting bone structure deteriorates, teeth may become loose or change position. The urgency of addressing gum disease. Ignoring the signs of gum disease can lead to severe consequences, including tooth loss and the need for extensive dental procedures. Moreover, the systemic health risks associated with periodontal disease underscore the importance of prompt intervention. Traditional treatments often involve professional cleanings, scaling, and root planing, and in advanced cases, surgical interventions. While these methods can be effective, they may be invasive, costly, and uncomfortable. Seeking a natural and effective solution for those looking for a non-invasive, natural approach to combat gum disease, there are options available that address the root cause of the condition. These solutions focus on eliminating harmful bacteria, reducing inflammation, and promoting the regeneration of healthy gum tissue. If you're ready to take control of your oral health and explore a proven method to combat gum disease, click the link in the description or the pinned comment below. Discover how you can restore your gums and teeth naturally and effectively. But what really causes gum disease? Most people think gum disease is just about not brushing enough or forgetting to floss. But the truth is, it's much more complex than that. Gum disease isn't a surface problem. It's a deep, internal issue that starts when harmful bacteria begin to take over your mouth. These bacteria feed on leftover food particles, forming a sticky film called plaque. If not removed properly, this plaque hardens into tartar, which settles below the gum line, irritating and inflaming the soft tissue that holds your teeth in place. But here's where things get even more serious. Let's take a look at the main culprits that silently trigger gum disease, often without you even realizing it. First, poor oral hygiene. Yes, it plays a role, but not in the way you think. Even people who brush and floss regularly can suffer from gum disease if they're not reaching below the gum line, where the real danger lies. Second, smoking and tobacco use. Cigarettes and other tobacco products drastically reduce your mouth's ability to fight infection. Smokers are up to 6 times more likely to develop gum disease than non-smokers. Third, a poor diet. A diet high in sugar and low in essential nutrients weakens your immune system and feeds the harmful bacteria in your mouth, allowing them to spread faster and deeper. Fourth, genetics. If gum disease runs in your family, you may be more susceptible, even if you take good care of your teeth. That's why many people feel frustrated when nothing seems to work. Fifth, chronic stress. Stress affects your whole body, including your oral health. It weakens your immune response, making it harder to fight off the bacterial infection that causes inflammation and tissue damage. Sixth, medications. Some medications reduce saliva production, leading to a dry mouth, which is the perfect breeding ground for bacteria. Less saliva means less natural cleaning and more risk of gum problems. Seventh, underlying health conditions. Diabetes, autoimmune disorders, and even hormonal changes, like pregnancy or menopause, can increase your risk of developing gum disease by making your gums more vulnerable to infection. Eighth, an imbalanced oral microbiome. Here's a shocking fact. Your mouth is home to over 700 types of bacteria. When the bad ones outnumber the good, your gums begin to break down, and brushing alone won't fix that imbalance. Natural ways to fight gum disease that actually work. Now that we understand what causes gum disease, let's talk about something even more important. How do you fight back, naturally? What if I told you that you could begin restoring your gum health from the inside out, using time-tested natural methods that cost you little to nothing, and that you can start using today? Let's dive into some of the most powerful natural solutions to stop bleeding gums, fight infection, and bring your smile back to life without relying on painful surgery or expensive dental procedures. Number 1. Anti-inflammatory nutrition. Your gums are tissue, and tissue responds directly to what you feed your body. A pro-inflammatory diet full of sugar, refined carbs, and processed oils literally fuels the bacteria that cause gum disease. But a healing anti-inflammatory diet? That does the opposite. Focus on eating more of these healing foods. Leafy greens like spinach and kale, rich in vitamin C, which strengthens gum tissue and speeds healing. Fatty fish like salmon or sardines, packed with omega-3s that reduce inflammation in the body, and gums. Nuts and seeds, especially almonds, walnuts, and chia seeds, which support bone health and fight bacteria. Crisp vegetables like celery, carrots, and apples, they naturally clean the teeth and stimulate the gums. Onions and garlic both contain antibacterial properties that target harmful mouth bacteria. And don't forget, cut the sugar. Every time you eat sugar, the bacteria in your mouth throw a party, producing acids that destroy enamel and inflame your gums. Number 2. Herbal remedies and natural oils. Ancient cultures knew the power of plants, and modern science is finally catching up. Some herbs and oils have powerful antibacterial and healing properties that work wonders on your gums. Clove oil. This natural pain reliever is a powerful antiseptic that reduces gum inflammation and kills bacteria. Tea tree oil. Used in diluted form, this essential oil can help reduce bleeding and swelling caused by gingivitis. Aloe vera. Not just for sunburn. Swishing with aloe vera juice or applying it directly to the gums helps soothe inflammation and support tissue repair. Sage, a natural antibacterial and astringent herb. You can brew it into a mouth rinse to calm inflamed gums. Turmeric. With its active compound curcumin, turmeric is a natural anti-inflammatory and antibacterial. Mix it with water into a paste and apply it to the gums to help fight infection. These remedies don't just mask the symptoms, they target the root causes, bacteria, inflammation, and tissue damage, while promoting deep healing. Number 3, stay hydrated. Your mouth needs saliva to function properly. It cleanses, protects, and fights bacteria. So if you're dehydrated, you're not producing enough saliva, and bacteria thrive in that dry environment. Make sure you're drinking at least 8 to 10 cups of water per day. Add a squeeze of lemon in the morning for extra detoxifying support. Also, cut back on alcohol and caffeine, which dry out the mouth and disrupt your body's natural detox processes. And if you're a smoker, this is your sign to quit. Not only does tobacco drastically increase gum disease risk, it slows healing and damages blood vessels in the gums. Number 4, clean smart, not hard. Here's a surprising truth. Brushing harder won't save your gums. It might actually hurt them more. If your gums are already inflamed, using a hard-bristled toothbrush or brushing too aggressively can cause further damage. Instead, use a soft bristled toothbrush. Brush in gentle circular motions. Don't forget to brush your tongue. It harbors a lot of bacteria. Floss gently, especially around inflamed areas. Consider oil pulling, swishing. Coconut oil in your mouth for 10 to 15 minutes. This ancient Ayurvedic practice helps pull toxins and bacteria out of the gum tissue. Final thought. If you've been dealing with swollen, bleeding, or painful gums, if you're tired of bad breath and tooth sensitivity, or if you've been told you need surgery, don't give up. There is hope, and it doesn't have to involve pain, trauma, or expensive treatments. These natural methods are powerful, and when combined with the right internal support, the results can be life-changing. If you're ready to take the next step and discover a safe, fast, and natural way to restore your gum health, click the link in the description or the pinned comment now. Your solution may be closer than you think. And if you like this content, don't forget to like, share, and subscribe so you don't miss the channel's news. Until next time, bye.